Hello folks, I am speaking to you today from the Advanced Neurofeedback Center here in Dallas. If you want to find us on our website, you can find us at neurofeedbackcenterdallas.com and you'll find out a lot more information. But the purpose of this video today is to inform a lot of you who have contacted us in the past or been our former patients about the new work that we're doing here and the growth of what is happening in the field of neuroscience and in neurofeedback, which is huge. There's been great development of in neurofeedback in what we have been using since 2014 called LORETA Neurofeedback. And LORETA is an acronym for a low imaging type of brain mapping and allows us to look into the deeper structure and see how the EEG is performing. This is really valuable in that we can also target with LORETA neurofeedback the deeper structure areas that need remediation. If for instance, mood regulation is involved, then the amygdala is involved, and that's a deep structure area. If memory is involved, then the hippocampus is a region of the brain that's also a deep structure area. The cingulate gyrus having to do with so many things, attention, but also functional areas of addiction and obsessive compulsive disorders and so forth. So those things have been really wonderful to be able to use with patients. But in what we are using now is something called swLORETA. So there's been this huge leap in terms of what we're able to do now. This area that is included in the brain now for us to look at and to actually work with is called the cerebellum. Typically looked at the cerebellum as being only involving balance and proprioception activity and so forth. And of course it has a lot to do with that, but research is that the cerebellum area, the areas within the cerebellum, the habenula, the thalamus, subthalamus, red nucleus. A lot of these areas have, some very direct functional things that have to do with sleep regulation and so forth. But specifically in the cerebellum, what comes out of that is that's where the monogenic action is taking place. That has to do with the development of the neurotransmitters of serotonin, dopamine, and norepinephrine. And that is mood regulation. It has a lot to do with people being able to find greater success in dealing with depression and anxiety disorders. Very important, also very important in terms of many other activities in the brain. So with the cerebellum being included, this has been let me give you an example of the difference between the regular LORETA neurofeedback that we were doing, is that we could see in that in terms of space in the brain, they call it voxels, voxels of space within the brain that we could target and look into regions of the brain. So what we had before were 7,000 voxels of space to analyze. Now this has brought it to 12,700 voxels, over 12,700 voxels of space. That's a huge change. And another way of looking at it as well is that if they take the cerebellum and were to lay it out over the cortex, it would cover 80% of the cortex. So when you think about this change in what we're doing, we've added 80% more brain territory to be able to evaluate and to work with. Now, what has that done? Well, it helps us to link symptoms to the brain much better. We have much better results in what we're able to target and to be able to help people with. And I think this has actually sped up what we've been able to do with working with the advanced neurofeedback in swLORETA is what it's called. So that's what we're doing right now. I also want to let you know, because we're in the midst of COVID, we are doing everything according to what medical science is telling us that we need to do to protect ourselves and to protect our patients. All of our patients wear masks. We wear masks during the time we're in the office and with our patients. We've limited the waiting room to only 2 chairs. We ask people to come only when they have their appointment and not to be sitting in the waiting room with other people, so that the waiting room doesn't get crowded in terms of space. So the other thing that we do is that we wear gloves. We were wearing gloves before, but we wear gloves and we sanitize all of the areas and the cab. We also are taking temperatures, making sure that. So that's a lot of the things that we're trying to do to help alleviate any problems with that. Now, I'd like to just pause here and go to my computer and show you some of the things we see in terms of the new software, and just discuss briefly a case that we could see differences from the beginning, a baseline, and then to 10 sessions later or 20 sessions later. Okay, here we are again. My name is Dr. Pamela Bell at the Advanced Neurofeedback Center here in Dallas, and I'm going to present a case of a person that lost their ability to speak. The described diagnosis was aphasia, transcortical sensory posterior aphasia is what we diagnosed. And I want to first show you the image on the left because it describes the baseline of this patient. This patient is in the early 80s, and the brain map, the LORETA image that we see on the right, is after 10 sessions of neurofeedback, of swLORETA neurofeedback. So I'm going to widen this image a bit and let it take the full screen so we can see the LORETA images. So the LORETA images are on the left, and the LORETA images, we can put our crosshairs on here, our pointer, and we can go to the deepest area of abnormality of that frequency, and find out a lot more information about that specific area. But basically what you need to know is that we're looking only at right now an image that is showing us what's happening at 1 hertz delta frequency, and delta is a sleep frequency. 1 hertz is the deepest of the sleep frequencies. And so what we're looking at in the blue in this image, and this is a low resolution brain electromagnetic tomography map, or LORETA, on the left, these images, and we can zero in and see different slices of the brain when we're looking at the image. When we look at the image in the middle, we're looking at brain with the described area with the blue, meaning the deepest abnormality of the 1 hertz frequency that we can see on the surface of the brain, that's showing up also in these LORETA images on the left. but we also see a lot of lines. These lines are showing us what's abnormal in terms of the connectivity, or what we call coherence. What is abnormal connectivity in the posterior region of and transcortical region of this person's brain. When these lines are here in the red, oranges, and yellows, they're showing us the over connection between these particular regions of the brain from the left to the right. In other words, the information being shared is not being shared very well, and it's stuck. Basically, the language centers of the brain from the left and the right side of the brain are not being transferred in a efficient way. So it causes this problem for the patient in not being able to find the words, to speak the words fluidly, to have sentences, to describe what they want, an extreme difficulty for this patient. So this is what we see at 1 hertz. Now I'm going to bring this image back down so we can see what happened after 10 sessions of LORETA Z-score neurofeedback. Well, at 1 hertz we can see a tremendous change in that effective area of the both in the delta frequency of 1 hertz that has become normal, and what we've seen in the sharing of information and the connectivity has reduced tremendously. So a lot of those connections have cleared up, and that's extremely positive. Oh, we do see a little bit of blue still up here, meaning that this area is still needing some of that deep sleep frequency of 1 hertz in that area. But let's go on and look a little bit further at some different images at different frequencies. So this is at 1 hertz. Let's just keep both images up here for now, and we will look at the images going up to through her problem. So here's 1 hertz, and here's what's going on at 2 hertz baseline, and this is 2 hertz after 10 sessions. Again, a lot better. 3 hertz, yeah, still a great deal of problem. 3 hertz delta, still a lot more efficient than it was before. We can see that efficiency has increased a great deal. Let's see what's happening at 4 hertz. 4 hertz, a lot of inefficiency in the brain in terms of the aphasia problem, the inability to speak her words, to be able to communicate. When we look at it 10 sessions later at 4 hertz, we see a lot is still there. Okay, so here's where we begin to see that, well, we got some activity change at 1, 2, and 3 hertz, but when we get to 4 hertz, we're seeing still areas and frequencies that we need to do more work. Here we are at 5 hertz. This is, again, her baseline, and we see tremendous problem with very high amplitudes of 5 hertz, and the image of the one on the right, if I can get my mouse to work here for us, here we go, 5 hertz. We can see, well, yeah, see the images on top, the LORETA, the low imaging resolution brain electrotomography, that's normal. Okay, so 5 hertz is normal for this patient after 10 sessions, but the connectivity is still a problem. Okay, we can see that needs additional work, and that's why we will continue always. You can't get done what you need to do in any 10 sessions with anything. So here we go at 6 hertz in both images. And 6 hertz, we see a lot of slow wave frequency in what we call the theta frequency, and a bit foggy brain, inability to understand. And we see a lot of that as well in the second image. More clearing in the right brain than in the left on this image after 10 sessions, but when we look at the connectivity, we got some shift, we got some change in this. If we look right into the middle along the vermis in the main line area between the hemispheres, there are some connectivity shifts that are positive in both arenas. So when we go up at 7 hertz, we still see the connectivity problem, but not as much of the really no problems when it comes to the abnormality in the frequencies being elevated too high. Just that the connectivity is much too high, or what we call overconnected, the inefficiency of the connectivity. So this is basically that case. I wanted to share with you what we see that typically happens when we're looking at a case with anyone. Where are we making the biggest changes for someone over 10 sessions, and we reevaluate and know where we want to go. So thank you very much for listening.